when it comes to losing weight, we know there is not a one-size-fits-all solution, unfortunately. But there is help and there are options out there. And here with more info from the Weight Loss and Bariatric Care Clinic at Evergreen Health are Doctors Sonia Hans and John Dawkins. Thank you so much for being here.
Thank you.
Thank you.
We've been hearing so much every day in our lives about weight loss, the journeys, the things. But Dr. Hans, let's talk the big picture here. What does a healthy lifestyle look like?
So a healthy lifestyle has 3 integral components to it.
Okay.
Movement, wellness, and nutrition. Movement is about doing about 200 minutes of some type of activity, 200 minutes a week, and it can be anything from a power walk to dancing to even playing tag with your children.
Oh, okay.
You just want to get moving.
Yeah.
The second is wellness, which has become a bigger focus on overall healthy lifestyles.
Yeah.
That's stress management, sleep hygiene, and mental health, big component. The third we do talk about all the time is nutrition. So that's following a healthy, nutritious lifestyle plan, eating, healthy foods, avoiding refined sugars, avoiding processed foods, drinking plenty of water.
Yeah.
So these 3 components together are essential for a healthy lifestyle, and they are a foundation for those on a weight loss journey.
Yeah, and I keep reminding myself all the time, like, this is what I just need to do. Sometimes it's harder than others, though, to make sure you're balancing that. So, Dr. Dawkins, your clinic has 3 different pathways to help folks out, right? Can you kind of describe those pathways to weight loss for us?
Absolutely. So Evergreen Health has 3 programs that use an evidence-based clinical approach to help people reach their long-term weight loss goals. Our first program is called Healthiest. It's a primary nutrition-led program with our excellent dietitians. We focus on individual and group counseling. As part of that program, you'll get a body composition analysis. We'll also assess your metabolic rate, so we can tailor our nutritional goals for your individual physiology. They'll meet with the dietitians at least once a month for 6 months, and as part of their program, you'll get the tools and resources and support for long-term success, including cooking whole foods, fitness, sleep management, reducing stress, and that continuing ongoing support. That's our first program.
Okay, sign me up.
It's a wonderful program led by our dietitians. Our physician partner program is very similar to our Healthiest Best program. You will meet with myself or Dr. Hans, and we can offer FDA-approved medications to help optimize your long-term weight loss and continuing ongoing nutritional support. Our bariatric surgery program is our final program. This is for patients with more severe advanced disease processes or comorbidities or need to lose a substantial amount of weight. This program is very similar to the other programs in that you get ongoing nutritional support both pre and post-op and lifelong management, but we tend to look at all these programs as a multidisciplinary team approach. Every doctor that we work together with, sends patients back and forth. We all talk as a team to provide the best treatment care for patients.
Wow, it really is very comprehensive.
Yes, ma'am.
Dr. Hans, we've been hearing a lot about pharmaceuticals that do help with weight loss, like Ozempic, Wegovy. Is it appropriate to use these medications for weight loss, and when is that time?
So weight loss medications all have their time and place in someone's weight loss journey. Ozempic is an FDA-approved medication for diabetes, yet its equivalent drug, semaglutide, or it's called semaglutide, its equivalent medication called Wegovy is FDA-approved for weight loss.
Okay.
And so Wegovy is what is being very popularized, and it has its time and place. But medications are something that, the when and how much and which one really requires medical expertise. And so this is where we advise to work with a medical expert such as Dr. Dawkins or myself that understands obesity medicines, these medications, how they can interact, when they're suitable, when they may not be suitable. It's really important to remember that because they are effective when used appropriately.
Yes, that's so important. And I'm sure you all deal with a huge mental health component to this as well, which is so much a part of everything. Dr. Dawkins, what can a patient expect when they walk in for the first time for their very first appointment? Because I can imagine it might be a little scary.
It is scary. It's difficult to lose weight, and everybody's unique. And so the first thing we want to do is try to get to know patients and establish their goals. And once we understand the patient's goals, as well as their motivation, we can tailor an individualized program to help them reach their long-term goals. We'll be with them every step of the way. We have a very supportive team, to follow patients for the rest of their lives. And it's challenging, to lose weight. We want people to feel comfortable to come in, and we'll always continue to work with them. We encourage anybody who may want to lose some weight or just get more information to come in and sit down with us. We can take you through the steps of the program, and we'll support you. Weight Loss and Bariatric Care is an excellent program. We're one of the few programs in the region that are actually board certified in bariatric surgery and obesity medicine. We're a qualified center of excellence, and that's because we've proven that our outcomes are FDA approved and we provide great long-term outcomes.
Well, and if the folks are coming to meet two doctors like you, I can't imagine how much more comfortable they would be. Thank you both for taking the time to share all this and explain some of these things that we've all been wondering about.
Thanks so much for having us. This has been wonderful.
Absolutely, you're welcome anytime. And to learn more about what we discussed today and reach out to the weight loss and bariatric care team at Evergreen Health, just visit the website that's right there on your screen, evergreenhealth.com/weight-loss. It's right there. Just check it out.